Hi, everyone. Thanks so much for joining us for USVI News. I'm Emily Matson. A huge amount of heartache and sadness carries throughout the territory with the loss of an incredible USVI icon. The legendary broadcaster Addie Otley has passed away at the age of 80. Addie was a longtime pillar of the U.S. Virgin Islands in radio, television, and served as a former senator, lieutenant governor, and Rotarian. Our USVI News' Addie Otley has more on his decades of contributions in broadcasting career and service to the U.S. Virgin Islands.
It is with enormous sadness to share the passing of the VI's beloved Addie Otley, who made so many contributions to the U.S. Virgin Islands in his lifetime. But it isn't only his contributions and incredible service. Addie Otley was and forever is a USVI icon with all the heart, smile, grace, and smooth broadcaster voice that is etched in our minds and hearts forever. To share a few of his incredible accomplishments, Addie was a legendary broadcaster, starting at his radio station WSTA. He got his start as a teenager at WSTA through the help of another radio legend, Lee Carl, and Addie followed the calling. After college, he came home to St. Thomas and was a radio correspondent, joined the Carnival Committee, and moved into politics, becoming lieutenant governor in the Melvin Evans administration. By the 1980s, the Addie Otley Morning Show was a staple and giant in the USVI, as well as his formation of Otley Communications. Addie was also a longtime talk show host of Face to Face on WTJX PBS and the live host of decades and decades of Carnival coverage. As Governor Bryan shared, quote, "Through his warmth, generosity, and kindness, Addie became the voice of the Virgin Islands, and in so doing, he gave voice to thousands of Virgin Islanders through decades by sharing his broadcasts with many residents who called his program. Addie treated all people with respect and dignity, and he wielded an influence in the community that crossed the boundaries of politics, culture, and humanity." And on a personal note, I'm so grateful to have known Addie Otley and can remember us doing interviews throughout the years. Addie also hired my dad when he was growing up in St. Thomas and gave him a job at WSTA. I say that to say that Addie not only loved our people and the U.S. Virgin Islands, but he inspired so many and served and helped make many dreams come true, sharing heartfelt love to all who knew him, family, and friends. In St. Thomas, Addie Otley, USVI News.
Thank you, Addie, for that beautiful tribute to such an amazing man. And we want to send a big congratulations now to Katie Tannenbaum, the lone USVI athlete who competed this week in the Olympic Games in Beijing. The 36-year-old won't medal, but that doesn't mean everybody here in the U.S. Virgin Islands aren't so very proud of her amazing accomplishments. The newest Virgin Islands Olympian was only able to do 2 practice runs before her first heats this week because she was in isolation after a positive COVID test. According to a social media post, typically she'd get about 50 practice runs down the track. Again, she only got 2. Tannenbaum that was the only representative of the Virgin Islands. Again, a big congratulations to you, Katie, our newest VI Olympian. Cases of COVID-19 have been remaining steady for yet another day, going down on St. Croix. According to the latest numbers from the VI Department of Health, there are currently 264 active COVID cases territory-wide, with 155 on St. Croix, 97 on St. Thomas, and 12 on St. John. And our healthcare workers have been through some of the toughest times with this pandemic. And on top of everything, our hospitals have experienced problems with staffing shortages. As we have reported, the Juan Louis Hospital in St. Croix has had to ask for outside help with its staffing with its ICU. Our USVI News Washington, D.C. correspondent Rachel Knapp tells us what Congress is trying to do to solve the problem.
Healthcare has been navigating through a lot of challenges.
Senators say the pandemic helped create shortages in almost every industry, including healthcare, impacting local hospitals and medical centers.
Healthcare workers have handled long hours, overcrowded facilities, fighting a deadly new virus.
AHN St. Vincent's Hospital's chief medical officer told us back in October they've struggled with staffing issues. And back then, a third of their nursing staff were travel nurses who work short-term positions at hospitals and clinics all across the U.S. And years down the road, doctors worry the crisis will get worse.
Primary care is in a crisis, as you've already alluded, between burnouts, early retirement, an aging workforce, and competition with other medical specialties. As Senator Hickenlooper said, we're headed for a predicted shortage of almost 130,000 physicians by 2030.
And that's not all. Senators say, according to the Association of American Medical Colleges, we'll also need to hire at least 200,000 nurses over the next 5 years to meet the increased need.
If we're going to make a dent in these daunting estimates, we need to get started now.
Senators are taking a hard look at how to retain and train people to meet the healthcare workforce demand. Some suggest improving workforce conditions to prevent burnout. Others suggest encouraging kids at a younger age to pursue a career in healthcare could be a start.
We got to make sure we're at least coming up with some good ideas and not necessarily just spending money on the problem.
But some say additional funds could help, especially in building a more diverse workforce.
We need to double the Pell Grant, embracing the only national program that helps low-income students achieve higher education would serve the nation and ease the path to needed professions.
Some members say vaccine mandates also pose a threat to the workforce shortage. However, the data about how many have quit because of the vaccine requirements in the healthcare industry is unclear at this point. However, back in December, the CDC said more than 77% of healthcare workers are vaccinated.